Hi friends, this is Dr. Ravi Kamapali. I'm a board certified infectious disease wound care and obesity medicine doctor in Augusta, Georgia at Diabetes Center, working on the platform of removing barriers to healing. And I want to bring to the front a discussion regarding non-communicable diseases that are pandemics in slow motion. This topic has gained more importance now that we have coronavirus pandemic, and WHO has announced week of action for non-communicable diseases from September 7th to 13th. And this week of action is what I want to use to help our patients and our community and the world at large at the effects of non-communicable diseases that are having on outcomes on infections. You can follow me at Wound Physician on Twitter, and www.indiabetes.com is where I practice at IN Diabetes Center in Augusta. And my conflicts of interest are nothing but removing barriers to healing for obesity, infections, wounds, using people, process, and technology. As you might be aware, there is a lot of mortality and morbidity, and non-communicable diseases in low and middle income countries contribute to that a lot. And 71% of all the deaths are due to non-communicable diseases worldwide. And of that, 41 million people die each year. That is equivalent to almost 71% of global deaths. And most of the problems in these global deaths happen in between the age of 30 to 69, effectively having a significant impact on the economic outcomes of the countries where these people are affected more. There are four major non-communicable diseases that are influencing this problem, which are coronary artery disease, that is affecting 17.9 million people, cancers affecting 9 million people, respiratory diseases affecting 3.9 million people, diabetes 1.6 million people. All these four account for 80% of the premature non-communicable diseases. And also we have to understand that and have noted that tobacco use and also problems with use of alcohol affect problems that impact the outcomes of deaths. And we can understand that these are all modifiable risk factors. We have noted that with tobacco use and increased tobacco use and lessened physical activity, there is a deleterious effect on outcomes. And obviously, alcohol increases the risks of non-communicable diseases. We have seen that tobacco affects around causes around 7.2 million deaths every year, and exposure to secondhand tobacco is also a major impact. There is a discussion regarding salt and sodium intake, but I do believe that there is a significant issue with that because salt and sodium might not be the real issue. Maybe there is other factors that contribute to it. Obviously, we have noted that insufficient physical activity contributes to a lot of problems. But the focus of my discussion for bringing out non-communicable diseases to the front of this discussion as an impact on infectious disease outcome is because I'm an infectious disease doctor, but also want to bring to the front that metabolic risk factors are a huge impact. If you note that the metabolic changes that happen increase the risk of non-communicable diseases. Now, what is metabolic risk factors are something a criteria called metabolic syndrome. Syndrome is nothing but a compilation of symptoms, and there are 5 symptoms that we need to notice, which is not being noticed by the healthcare community at large and also the populations at large. So we need to understand that high blood pressure and high blood sugar and hyperlipidemia. In hyperlipidemia, there are two things called high triglycerides and low HDL. And obviously, the weight and morbid obese conditions wherein the waist circumference is more than 35 inches in female and 40 inches in male, contribute to a compilation of criteria of 5 of the conditions, 3 of which, if present, then the patient is diagnosed as having metabolic syndrome. Now, WHO has informed us that to reduce the infection risk of coronavirus, we need to use hand washing and using alcohol, hand sanitizers, and soap, and also cover our mouth with mask when we sneeze or cough, or when we are in close contact with somebody or in a group setting. That is amazing, and it prevents the load of infection transfer from one person to other when people are speaking or when people are spewing out bacterial or viral pathogens. Now, how can anybody fight infection when they are getting bacteria? Number one, our innate immune system has that capacity. So how does the innate immune system be effectively noticed? Is when people are healthier. Healthier people can easily fight disease more better, and we have to have plans to address how improving metabolic health of the people help with improvement of ability to fight infectious disease problems. And obesity has been noticed to increase coronavirus infection by almost sevenfold. And for influenza, it almost increases it by fourfold. I'm telling it out of memory, but I have noticed that and I've presented on that before. Now, how can we improve the health of a person is depending upon a better, healthy dietary lifestyle, not just a diet, but a dietary lifestyle. And it depends upon how we include diet into the daily habits of care, and how the timing of eating, how the kind of processed foods are avoided is very much important. And obviously, physical activity helps, but physical activity is only 15% of improvement of health of a person. Avoiding alcohol and tobacco is very important. It has been noticed that severity of COVID infection is increased 1.5 times more when people are smokers. And we have to understand that in people with heart disease, diabetes, cancer, asthma, or infections, increase the infections, including when people have high blood pressure, they are at higher risk of severe outcomes once they get COVID-19. But the issue is they are not at risk of getting the infection, but the outcomes do become a problem when you have these non-communicable diseases. So the outcomes worsen in people who have non-communicable diseases in the presence of exposure to the coronavirus. So why are we stressing this during this week? Is non-communicable diseases are pandemics in slow motion, and they do influence infectious disease outcome. While death is reality and is inevitable like taxes, we need to understand that it does not need to be slow, painful, and premature. I have seen a lot of people die because of peripheral vascular disease, lower extremity infection, diabetic foot infections, and problems associated with all the non communicable diseases that are like last straw on the camel's back. And the path to this whole process is simple. We need to understand that nutrition is one path and an addiction is another path. We need to create processes and approaches wherein we blend nutrition and addiction and services together, and also bring up solutions wherein we can deliver comprehensive service lines to patients that help them and empower them in improving their non-communicable diseases. This is a week of action for non-communicable diseases. We have had enough talk, and it's time for action. And I, as much as I propose and advocate for masks, hand washing, I want to stress that it is our mouths and what we eat that impacts what happens. We have to understand that our metabolic health matters more in this pandemic scenario, and we ought to prevent the metabolic syndrome, reverse metabolic syndrome, including metabolic syndrome criteria that need to be diagnosed and looked at. Simple waist to height ratio of zero point 0.5 or less, and measurement of blood pressure, blood sugar, lipid profile. And obviously, all these criteria have to be accounted for. And we at Iron Diabetes Center are here for you to help with those problems, including diabetes, endocrine problems with infectious disease, wound care, peripheral vascular podiatry, and metabolic syndrome issues. As a team approach and excellence in service delivery, we pride ourselves in taking care of patients and helping them through their healthcare journey. Please feel free to call us at 706-868-0319 and www.indiabetes.com. Thank you very much and have an amazing day.